everyone, welcome to this episode. This is Transformational Talk Show. I call it TTS. It's yet another program that I want to launch. As you all know, I have a ministry known as TDM, that is Transformational Dance Ministry. And along that line, I also thought of doing something known as TTS, that is Transformational Talk Show, whereby it's going to be dealing with quite a number of topics that I want us to venture into. And so welcome to this show. It is the first show that I am doing. Hope you guys will support and you will like. And so upon the topics that we are going to be talking about, we are going to be talking about so many topics. And one of the topics is health. And about health, that's when I'm going to briefly talk about music therapy. I'm also going to be talking about life, talents, gifts, relationships, achievements, challenges, goals, disappointment, friendships, making it, and also things that caught us unaware, as well as other topics that you guys may prefer for us to talk. On top of that, I will be bringing other people on board. I'm not going to be doing this alone, so we are going to have other people on board. We're also going to come and share with us one or two concepts so that we can all of us learn. You see, you might be wondering, why Transformational Talk Show? Why TTS? We have so many shows in this world, and for me, I thought of doing a Transformational Talk Show because, first of all, when you talk about transformation, it's like being transformed. Change is like change, or moving from one point to another. That's why you call it trans, from one point to another. Talk, we definitely have to talk. You see, one of the solutions that we can apply in this world is through talking, communication, sharing ideas. You give me yours, I give you mine. We exchange ideas. Definitely it's a show. So it's a show whereby we are going to be talking about things or other concepts that are going to help us to transform ourselves and such kind of a thing until we accomplish the best that is found in us. If you have any question, you can ask. Feel free to air out your views. So the first topic that I chose to start with was health. And I will narrow down. Health is very diverse, but I will narrow down to something known as music therapy. Recently, or rather some few weeks back, there was a video that went viral that I actually did to a particular patient in hospital, Kitale National Hospital. And that video, basically that video is all about music therapy. Music stroke dance therapy. It's just one of the same thing. And some people might be wondering, what is she doing, or what is the essence of doing that? And maybe some of us, we don't understand what is going on. And you know, sometimes you can be viewing something and probably you are not aware, you don't know what is this concept. That is music therapy. Now, so I will briefly tell you about music therapy so that we can all understand. All right? Yes. So, music. We all know music. Music is just like a rhythm that is created, that creates that melodious form. You see, and in layman's language, music, tuseme tu ni wimbo. Sisi wote tunajua wimbo ni nini. And because it is a song, we have different types of songs depending on the target population that you want to perform to. Therapy, we all know what music is. So therapy is treatment Okay, therapeutic effects, psychotherapy. Tumesikia majina mingi kuhusu therapy. So we also now have something known as music therapy. So therapy is treatment. Now, when you talk about music therapy, in simple words, is a treatment that involves music. All right, treatment that involves music. And also you can say treatment intended to heal or to relieve a disorder. So that actually again involves music. Now I will talk about what is briefly talk about some few, like 1, 2, 3, 4, 5. The five importances of music therapy. Why do music therapy? You see, for everything that you do, you always have to have a reason. You always have to have an objective. You can't just end up doing something and there is no goal, right? We call it losing purpose. So you have to have a purpose as to why you are doing a particular concept. Now, one of the basic reasons of doing music therapy is that it reduces stress and improves mood and self-esteem. It reduces stress, improves mood, and improves self-esteem. Now, music soothes the soul. We all know the effects of music. Hata wewe, if you're just relaxing kwa nyumba yako and you just you just play some music and you feel so comfortable, or there's some sort of song that unaeka and you feel so uko better, you are at a better place, and music heals. Music is spiritual. So there's quite a lot of concept about music, which we will not talk about it today, probably another time. But now in the hospital setup, it is able to reduce the stress of a particular patient, and also it improves the mood. Now, let us look at that video that happened, that went viral. Music was involved, dance was involved. Now, what happened to that child who was actually trying to imitate me, it's like a response. That child responded, and he was trying to lift his leg even if he was not able to because he had a fracture. And so definitely, if that child, kama huyo mtu alikuwa ameboeka, definitely mood ili change, and kutoka hiyo siku mood yake ili change kabisa. It really changed that child's mood, so to a better mood. Yenye hata if you are a medical practitioner and you are attending to that particular child, you feel this child is okay, this child ako sawa. So it reduces stress. Napata, now you stop thinking about other things and now you shift to another world, right? So that is one major. Even you as a person, sometimes you are having an issue. And then you're just putting a song unaeka tu maybe kwa speaker ama kwa computer yako, and you just feel good. Music just makes you to feel good. That is what happened to that child. Another one is pain management. So we have talked about number 1 concept, and now we're going to talk about number 2 concept, pain management. You see, music therapy is a non-pharmacological way of reducing pain, or rather of managing pain. Pain management is not only done when it comes to medication and all that, the treatment modalities that happen. Music also plays a very big role in managing the pain. Alright? We have pharmacological and we have non-pharmacological. Pharmacological now are the drugs. You see? The pharmaceuticals, these are the drugs. But now we have another. When you are managing a patient, it is not only about medications. We have so many other ways of managing a patient. I'll give you a very good example. When you go to labor ward, and the labor ward, we have the pharmacologicals and the non-pharmacologicals. And when you scratch, or rather when it's like you're soothing the back of the woman and I feel better, So hapo haujatumia dawa. Unaona, you're using your hand, you're like just like touching them so that they can feel that comfort and such kind of a thing. Now it is now the same case that happens to music. It helps you to forget, it helps you, it shifts your mind, and you know it happens through the psychology. Ina happen sana sana kwa mind. So unapata you have moved from what you are thinking about to something else, right? Yeah. So it's also one of the pain management control. Another one is improving the coping skills. You see, to cope is to deal with. How are you able to handle a situation? Now, music or dance therapy improve the coping skill of this particular patient who is in the hospital. Now, we all know hospital sio kama nyumbani. When you go to the hospital, that's a different environment. It's an environment that is different from home. So wakati somebody is there, they need to cope with the people who are attending to them and such kind of a thing. Now when you bring in the concept of music, this child or any particular patient develop the coping skills, and you just find yourself relaxing. Okay, you are able to like you are just comfortable. You don't have to, I don't know, fear who or who, but inakusaidia for you to cope up with the hospital environment so that you can receive your treatment and get healed and then go back home to continue with your normal life. Another one is normalizing the hospital environment. Just like I said earlier, hospital sio kama nyumbani. That's a different environment that has its own rules and regulation, that has its own people operating there. Now when you bring in music si ya kuchezewa tu kwa nyumba. Now you try and bring in something else, music. It makes the hospital environment to be calm. You become comfortable. It is normal. So you don't have to be like stress yourself. Oh, niko kwa hospitali. You just relax. Like we can make reference to the video that went viral the other time. If you could look at that child's reaction, he was actually very comfortable. Hakukuwa na any issue, and yet he was sick, but your time he forgot that he was sick and every other thing, but akakuwa tu normal. Vile tu angekuwa nyumbani na ekewe muziki na a dance tu hivyo vile alijaribu ku dance. So you see, music therapy, it is something that should be embraced, and it is something that is actually working out. And in Kenya, we have hospitals that are practicing music on stroke dance therapy. We have other hospitals zenye ikifika Friday wanaekewa music, the children's DJ anakuja na dance na watoto, they wanaekewa music. So it is part of healing. It is what they need. Sio issue tu na madawa na madaktari and mashindano hapo and everything. It's like sasa ni kama you are somewhere different. No. A sick person ought to be taken care of. Right? Yeah, so and hata wewe if you want to be treated well, si kutreatiwa in terms of kama uko mgonjwa. Ukitaka kutreatiwa vizuri, you don't only get to be treated in one way. Leo unaweza letewa zawadi, leo unaweza dansiwa, leo unaweza pikiwa. We have various ways of treating someone for them to make them feel better. It's the same way to ukiwa huko hospitali. It's not all about those procedures, the medical procedures and medication and any other thing. So music therapy is also part and parcel of treatment. Of course, music therapy goes hand in hand with the dance movement therapy, and in the US, we have something known as American Dance Therapy Association. American Dance Therapy Association, whereby it's what I was doing actually. You are able to deal with you can also say psychotherapy. You deal with the mind, the mind, and then therapy, the treatment. So you are able to make a patient comfortable psychologically, their cognitive, their emotions. So it's like making the environment of a patient comfortable. Very, very comfortable, and that is what we want to see. Any good medical practitioner will want to see their any good medical practitioner would want to see the patients they are taking care of in the hospital wakiwa sawa. They want to see them healing and going back home. In fact, a good hospital haitakangi wagonjwa kukaa huko sana, because that is not home. You need to go there, get treatment, uangaliwe with the various personnel, with the various medical practitioners who are there, and go back home to your normal activities. Right? So we have to develop mechanisms that are able to make our patients be at a better place, or rather for them to actually enjoy. So music therapy, it is actually something that should be embraced, and it actually promotes healing. I'll give you a testimony. In one of the videos that I did, very simple videos that I did, there is one person who had a condition. We call it no, I will not specify about the condition, but the person, she was a woman who is actually sick with a certain condition, and in one of the videos comment, akasema ati keep doing what you are doing, because people like I who have this and this condition actually need. So the woman specified people who actually this and this, who have this condition, actually need what you are doing, and that is the music therapy. Music soothes the soul, and you find that even those who are sick, they have a lot of things that actually goes on in them. They have a lot. That is when mtu atakiwa mgonjwa, sasa zingine tu unaanza, some of them hata wanafikiria when will they die, some of them think that they are going to die, you know, wanaonanga ni kama they are limited, kuna kuwa na limitation flani, right? So unapata when such kind of people, they need people who are able to tell them that no, this is not this, this is this. So when you're able to do something known as music, it makes them to feel calm. They feel like, kumbe hata ni normal, kumbe hata I can do it, you know. And for the music, it actually depends with the stage. The stage, not the stage, the age, more or less the same, the age of that. Ile music yenye ninaweza chezea mtoto mdogo, like for the young boy, alikuwa 5 years. Unaona, the choice of music that I used was Baby Shark. Baby Shark ni ya watoto. You don't expect ni dansie Baby Shark somebody with 60 years or 50 years or 30 years. It is not possible. So kuna the stages, or rather the ages ya watoto. Kuna wimbo ya watoto pia ninaweza nikadansia teenager mwenye ni mgonjwa, wimbo yake siwezi nikamdansia Baby Shark. Ikifika huko kwa age, and you know, we have so many conditions, many conditions that affect those people who are aging. We have diabetes, we have hypertension, others wengine wamekaa for so long na cancers and all that. All these conditions, they need to be looked into accurately, the pharmacological and the non-pharmacological, so that you can make the life of this patient in hospital to become actually comfortable. And so today I am glad to have tell you a little bit about music therapy. So if you have any question, if you have any question regarding music therapy, you can ask there in the comment section, and I will be gladly to answer it. So thank you very much. This is TTS, Transformational Talk Show by Lucretia, the Dancing Nurse. See you.